Hi, I'm Faye Randell, and I'm here to talk to you today about euthanasia, the physician-assisted suicide that is killing on request. Uh, I believe it is morally wrong. I have found through my research that most medical physicians also believe it was an extremist act carried out by Jack Kevorkian, who was known as Dr. Death. He passed in 2001. It was found to be that he had assisted over 130 people with physician-assisted suicides. And there were many health professionals that found him to be an extremist in his acts. I believe that our fate does not lie in a physician's hands. I believe our fate lies in God's hands. And the scripture that I use to back up this is Deuteronomy 30:19. God states, "This day I call the heavens and the earth as witness against you, that I have set before you life and death, blessings and curses. Now choose life, so that you and your children may live." And I move on, now moving on to the next point that I would like to make is the patient's rights. I feel the patient has the right to refuse or accept medical treatment, but I also feel that that patient needs to be competent in that choice. And if they are not competent to make that choice, and how competent are we when we're on our deathbed? We're in a lot of pain, and I feel that there's not very many people in their right mind to be able to make that choice. I feel that Dr. Kevorkian made that choice for them a lot of times, and I do not feel like that was morally or ethically acceptable. And to back up some of the patient's rights, I did some research and found that Solomon, there was an article, "Decisions Near the End of Life, Professional Views of Life-Sustaining Treatments." There were certain criterias and guidelines that were to be followed, and if they were not, those guidelines that were to be followed was that they were allowed to actually have care, and they were actually allowed to refuse treatment, but the refusal of the treatment was actually life-sustaining of competent. I'm sorry, I said that wrong. They're actually were allowed to refuse the treatment of life-sustaining. It's like the directive that we have now, the advanced directive that we can sign, that we don't want to be put on life support. We don't want our life to be prolonged if we know that it is inevitable that we're going to die. I don't believe that once, that a terminally ill patient that has cancer, I believe that the fate is not in the doctor's hands. I believe that the fate should be, in God's hands. I truly believe that very strongly. Moving on to my third point, there are only 4 locations in the world that still practice euthanizing, and that is Oregon, Belgium, the Netherlands, and Switzerland, I believe. I'm pretty sure it was Switzerland. Anyway, they practice euthanization. So only 4 locations worldwide. And as you guys can see in your handout, that's not very many places in the world. There's a little dot here, which is Oregon, and then of course Belgium, Switzerland, and the Netherlands. So there's not very many places in this world that believes in euthanization or even lets people practice it legally. And of course, the only one in the United States is Oregon. So that's not saying, that's not a lot. And I totally agree with that. I believe that is right on. There are also some, extremist groups out there that are the right to die groups. And, I found that some research, through my research, that an article that Humphrey had done, that the largest extremist group is found in Japan. And it's Japan Society for Dying with Dignity. They actually are the largest of the right to die groups. So, and then moving on to my 4th point, I wanted to go ahead and again hit on the fact, patients' mental stability while on their deathbed. Do we really feel that they are mentally stable enough to make this decision on their deathbed? They are in so much pain that I just do not feel that they are in their right mind to be able to make such a rash decision about their own life. We find that through some research by MasterVet, that the EAPC, the Eastern Association for Palliative Care, which is known to us as hospice here in the United States, they are responsible. They're the ones responsible for keeping a patient that's terminally ill with cancer or with MS or with AIDS, keeping that patient comfortable, keeping their pain tolerance down, keeping them as comfortable as they can until death. Which brings me to my last and final point, double effect principle. The double effect principle. There are 3 assumptions when we come to the double effect principle, and it's, the rush of death. Death is, hastened by the opioid drug, and it's not okay. It's not okay. It's not okay. Death is not welcomed. Hospice should be, pushed instead. They should be, palliative care should be given. Another thing that, should be assumed is do not cut life short. It's not okay. It's not okay to cut life short and end the suffering short. Give God that time. They're still here for a reason. And I believe that with all my heart. In closing, euthanasia is murder upon request. Choices regarding life should ultimately be up to the competent individual. I have discussed that euthanasia is ethically wrong as committing a murder. The patients have the right to refuse and accept treatment. There are only 4 locations in the world that legally practice euthanasia. Patients' mental capacity to decide the value of his or her life, and also the double effect principle. The traditional, double effect principle, the morality of it, and ethical aspects of it. And in closing, I would just like to say, I think that we all should consider that people should definitely have a right, that euthanization is murder. Thank you.